Tier 2 heats up the biological basis of behavior, and I like to call this when nature and nurture collide. Um, my 10 years as an educator for students with social, emotional, and behavior disorders gave me some extensive training that I'd like to share with you. One aspect was once a month I met with a psychiatrist for 3 hours to review the students and discuss their progress and challenges. And I learned a wealth of information about the biology and what's going on in our many of our students who struggle. Then, as a grandparent of 3 children that have developmental disabilities, among which is autism, I've spent the past 16 years researching and applying the results of that research in our family with great results. The grandkids are doing well, they're high functioning, but that's another part of what I want to share with you. And then the last component is districts have paid me to come and train their staff regarding managing their tough kids. So in this course, you're going to get the bulk of all I know. So hence why I only teach one course, but I'm going to dump it all right here. There are over 100 slides on this, so you're going to need to plan a little bit of time, but I promise you the information will be invaluable in helping you to have a mental set that just isn't taking this stuff personal and having a plan and knowing what to do. And as an administrator, being able to guide others. And it just helps make your environment safe, sane, and healthy for everybody. There's etiology behind challenges in moral reasoning. There's organic causes. And I've given you a list here that include mental illness, delivery complications, medications taken during gestation, illicit drugs, illness, injury during the pregnancy. There are some unknown causes, but in new research by the CDC, they're finding a high rate of developmental disabilities. And the same is true of other developmental and mental illnesses in our students, that they're linking genetic upbringing and poverty to some really tough behaviors and some challenges in students. And then poverty. Sadly, poverty is a highly predictive factor of our really tough kids. We also have environmental factors like emotional trauma. There's a lot of research out there now of trauma-based education. But when students have suffered or continue to suffer abuse, physical, sexual, emotional neglect, and abandonment, these little guys and girls just have some things that cause them to struggle in schools. I'm going to tell you, when I began to realize that genetics and upbringing conspired to create children who struggled, and oftentimes these little guys and girls seemed miserable. You didn't see joy, you didn't see the happiness. I'm going to tell you, I had to wrestle with my faith, my life circumstances, and my own genetic ancestry. It was tough stuff. Ultimately, I came to realize that there was hope for our most challenging students. There was hope for me. I turned out okay. At least I think I did. But it's going to take a huge investment from educators, and it would take a huge time investment on my part, on the part of my school, on the part of my school district and the administration, our counselors, our support personnel. But for me, mostly it would take prayer. The biggest difference in my own life happened when I was saved and the Holy Spirit worked in me. And that's the one salvation we're forbidden from sharing with our students. And it's sad, it's heartbreaking. So I became a prayer warrior for my students. And that's my best management tip. We're also going to take a look at other strategies and explore those that work for our most vulnerable and at-risk students. And I think that you will pick up some things that will help you be successful in your practice. The first thing we look at is that growth is multifaceted. That's why we took child development in our early education careers to be teachers. And development occurs across 5 areas. We have the mental and intellectual realm, physical realm, emotional realm, the social realm, and the spiritual realm. Some children will fail to develop typically across one or more of these domains, even though they may have typical growth in others. So for example, you may have students with average physical stature who lack the mental or intellectual components to be able to learn at the same speed as their peers. You may have students who have developed physically and mentally. Many of our toughest kids are quite bright, but they lack the emotional and or social development to mature and progress with their peers. And the spiritual component, of course, is my belief of what, and the belief of others, what happens when you have other forces outside of yourself that you can rely on to help you grow in one or more of those areas. So we're going to take apart the nature part of behavior. We're going to take a look at the biological basis. There are a number of systems in our body which impact behavior, and challenging school behaviors with a biological basis are predominantly related to the nervous and endocrine systems. The endocrine system, in my opinion, is amazing. It's composed of this group of ductless glands that just secrete hormones into our bloodstream, and those are absorbed into target organs. And those, the amount of chemicals in our bloodstream vary. They change person to person, sometimes within a broad range, and other times outside those ranges. And these glands are responsible for secreting 20 or more major hormones into our bodies, and they communicate responses such as stress, sexual development, insulin production, metabolic rate. We also have them regulate things like our mood, our ability to cope with stress, our joy and our happiness. This is a visual of the endocrine system. You can see some of the major glands that are affected. The adrenal gland and the adrenal system is regulated by the medulla, and it secretes two hormones, epinephrine and norepinephrine. And you hear this a lot when people are talking about bipolar disorder, mood disorder not otherwise specified, depression. These are chemicals that are neurotransmitters in our nervous system, and they're important for a lot of reasons, but the adrenal system itself is our fight or flight response. This is also super active in our children of trauma. If you have students that have an imbalance in these adrenal glands, you'll find excessive fatigue and exhaustion. The child that falls asleep at their desk, the child that has some sleep disturbances. You may have the person that feels overwhelmed. They can't cope with stressors. Anything bad happens, they melt down or they withdraw. You may have people who feel run down or overwhelmed. As I mentioned before, sleep disturbances, extremely low stamina. You can get some PMS type symptoms for women, some real emotional responses, and oftentimes you get aggression in men, although those can morph in different people. Irritability and anxiety are common. One of the most challenging students that I had an adrenal tumor, and I'm telling you, he could, when he got into the fight mode, sorry, he was a little guy, but he would throw chairs and desks, and it was a challenge and constant maintenance between the school and his care provider to help him be successful. In our students who experience trauma, and I had shared with you the extensive trauma of my childhood, the neural networks that are involved in stress, they stop working properly. And you'll see sometimes in the literature, they call this a cortical cycle. But trauma-related alterations actually happen to the brain and to the neocortex. And it makes it really difficult for them to regulate some of their emotional responses. You'll see a lot of flat affect. It also means that that sometimes they're going to wrestle with the content in school, the ability to learn and read. I was fortunate in that I was actually in the gifted program going through school. However, I believe I struggled socially and emotionally. Children who have experienced trauma will be in a persistent state of alarm, and they're less capable of concentrating when they enter classrooms. We had a little first grade student in our school this year, and last year in kindergarten, she was among our highest reading groups. This little girl learned how to, she grasped the sound and letter relationship. She was reading, and her mother left her with an quote uncle for a week while she went on vacation. And during this time, this little one quit talking, quit reading, quit interacting, and we learned that over the course of the next several months that she had been raped. And she just, even this year, through the whole year, has continued to struggle with even catching up to her previous level of academic abilities. And, most of us look at that and go, rightly so. But I'm going to tell you, most of that goes on, you're not going to know when you get this child as a 10th grader what happened in the first grade. But sometimes trauma is at the base. Then we have the thyroid and pituitary glands, and they regulate our metabolic rate. Overproduction of this hormone can lead to hyperthyroidism, which is characterized by weight loss, high blood pressure, muscular weakness. It causes anxiety, sleeplessness, irritability, and aggression. If, on the other hand, you have too little, it's associated with a slow metabolic rate, weight gain, sluggishness, irritability, lethargy, mental fog, or confusion. A lot of our children who don't have access to adequate medical care can suffer from these conditions and not know. My own daughter got thyroid cancer at 25 and had her thyroid removed. Her husband said during the period of time they were learning to regulate her thyroid level that it was like living with Sybil. Literally, her personality radically changed. Thank heavens we have modern medicine and ways to regulate that, and she's doing much better through the course of the last 15 years, but it's rough. The pituitary glands are called the master gland, and other glands release hormones in response to the hormones released by the pituitary, so it's kind of our command center. The pituitary is controlled by the hypothalamus, which is in the forebrain, and one of the more challenging students I had a growth pituitary problem, and he had to take growth hormones. And this little guy was, his growth rate was unstable. They'd give him the growth hormones, he'd grow several inches. His body hurt, his body ached. He was grumpy, he was aggressive. They'd quit giving him the growth hormones, and he would have periods of no growth, but not the aggression. And it was a balancing act. And he burned a lot of bridges, lost a lot of friends until we kind of wrapped some support around him. And the pituitary gland is a big organ in controlling how our students are responding. The pituitary gland acts as a bridge between our endocrine system and our nervous system. So the nervous system signals a stressful situation to the brain, and then the brain stimulates the pituitary to release the hormone that regulates our stress response. And it affects other organs, as we know, such as the adrenal gland, and it causes our vascular system to constrict, our muscles to become ready. And it also plays a role and factor in our students of trauma, because again, this system's constantly kind of heightened. Some conditions that relate to our endocrine system are that you will see frequently are mood disorders, obesity, caused by hypothyroidism. Hyperthyroidism can cause really emotional responses and kind of a heightened sense of alertness. There are a lot of congenital disorders that are related, some cancers, and now specialists include the post-traumatic stress disorder, which is now labeled PTSS, post-traumatic stress syndrome. So in that system with the endocrine system, and then of course now we have trauma-based learning that's also tied to this. The nervous system is the other major system in our body that can help conspire, so to speak, to create children with challenging behaviors. So it's the system that's coordinating and regulating all our responses to external stimuli. This activity is achieved by a group of these specialized cells that communicate chemically with each other, which blows my mind because they don't actually touch, they throw the signal. So it's kind of like having a great big fire bucket brigade passing the signal on. And then you have both the nervous and the endocrine systems that create chemically, but only the nervous system creates locally. And the endocrine system is more long distance. This is a graphic of our nervous system. Let me see if I can get this down here just a little bit. And it lets you see the system as it's spread throughout our body. The central nervous system, of course, is affecting the brain. Our peripheral system affects our extremities and our body parts. But all of our organs have sympathetic nerves that are created. And we are just now learning in some areas just how critical those nerve endings are to things like pancreatic functions. In addition to the brain and spinal cord, the nervous system includes all of our sensory organs. So the way that we are able to experience and interact with the world around us. These neurons are messengers. We have over 100 billion neurons, and some scientists estimate in the trillions. Many of these have the same features as other cells. But what makes neurons unique is their shape and function. As I mentioned, dendrites carry information to the cell body. Then the cell body has the actual nucleus of the cell, and then you have an axon that carries information to the dendrites, and that information is passed then to the next cell. The axons are coated with a myelin sheath that insulates and speeds up the neural impulse. Many disorders that break down this myelin sheath result in students that may have some challenging behaviors. Cerebral palsy, muscular dystrophy, especially with mood they're linking it to, and the list kind of goes on and on. The cells of the nervous system communicate information through an electrochemical charge. And there's two different classes of cells, neurons and glial cells. And the neuron and glial cells act like other cells in the body, but each one has a specialized function. One of the challenging parts about the nervous system is, unlike other cells in our body, they don't really regenerate. So neurons don't reproduce or multiply. So it's not like skin cells, they don't grow back when they're lost. So if you have students that had some gestational impacts, such as drugs or alcohol, or even where they're learning the illnesses in mothers, some type of physical impact trauma, those cells are destroyed. And in mammals, just after birth, much of the process of neural cell development just stops. The number of neurons at birth may be higher than later in life because the neurons die. And so in contrast to other cells, most of the neurons will never divide again and no new neurons are formed. There's hope in what we know about brain plasticity, the ability of other areas of the brain to take over. But the result of a loss of cells in the nervous system is that they will not regenerate typically. Glial cells are important because they insulate and support the neurons. They create the myelin sheath, they remove waste products, they provide nourishment, and they remove harmful substances. One of the things we know about poverty is it highly impacts this process. So your students in poverty are not getting the cell nutrition they need to develop typically. Again, that myelin sheath is a fatty material that wraps around and insulates the axon, kind of like layers of an onion. Babies have very, very thin myelin sheaths, so they can't hold up their head, they can't lift up their arms, it's difficult for them to move. And as this sheath thickens, we see babies begin to turn over, sit up. But for some children, such as those with cerebral palsy, for kids that have muscular dystrophy, other disorders, those functions don't typically perform like our typically developing children. And in neurotransmission, speed matters. It's kind of like having an electrical cord that's damaged. And if our brain is functioning strictly on neural impulses, you can see why some of those students are struggling to self-regulate. And as we talked about, myelinization occurs from birth and into later life. And then as we begin to age, of course, we see where those systems begin to, again, thin. So the neural impulse, to me, is just fascinating because really what you have is it's a polarity that causes the signal to flow, and ions flow across the cell membrane. So it's kind of like the charge is loaded, then it gives off its signal and then builds again. In between each nerve cell is a synapse, so there are tiny gaps between the neurons. And again, like I said, it's kind of like the bucket brigade where people are just kind of where we're handing off the signal to the next person. That's what the neurons are doing. The transmission between these has a lot to do with our mood, whether how our body feels, whether we experience pain. Some of this impacts people with fibromyalgia. Some of it impacts people who get some neuropathy. But the neurotransmitters are highly, highly important in how we feel. And so for some of our students, they just don't feel well. These aren't working well. And again, poverty and a lot of those genetic causes can impact this. So the neural impulse it's kind of an all or nothing. It either fires or it doesn't. Sometimes it doesn't fire. One of the things we know, for instance, in ADHD is that we always thought, oh, that their neurons are just super hyper excited, when in fact, the new brain research says it's more likely that that frontal cortex is actually under firing. And so all those executive functions aren't accessed, hence why you can give that student a stimulant, or, well, you can't, but their parents can, and the doctors can prescribe them. And it kind of wakes up that area of the brain so that they can self-regulate. There are some well-known neurotransmitters, acetylcholine, dopamine. We hear about dopamine frequently, and it plays a role in learning, memory, our emotions. Serotonin and endorphins, they're also found in the brain, and it sets our emotional tone. Endorphins will inhibit or turn down pain sensors. So your kids that struggle to have that perseverance, who give up easily, sometimes that's a challenge. And with our reduced activity in children, endorphin production is not what it used to be. No one knows what causes ADHD exactly, but as I said, the frontal part of the executive functions are just not working in that frontal lobe, not working as a typical student. In ADD, you can have students who are more likely to have it if they're born premature, difficult pregnancies. The same is true for children of head injuries. And studies show that pregnant women who smoke or drink alcohol have a higher risk of having a child with ADHD. Researchers believe that some toxins interfere with brain development. We know, for instance, lead. What doesn't cause ADHD is parenting. And although it's been debated, research doesn't show that ADHD is linked to eating too much sugar or watching lots of TV. We do know that ADHD can be exacerbated by certain types of food dyes. Food and Drug Administration almost banned red dye because the overwhelming evidence that red dye causes hyperactivity symptoms in children who do not have ADHD. And it narrowly was defeated, hopefully in the future. So parents who are telling you they don't want to medicate their child, you might suggest they really check out Tending with Diet. The doctor that oversaw our program when the parents didn't want to medicate their children with ADHD, he would suggest that they help their children develop habits such as green tea for breakfast, and green tea, of course, has a lot of other benefits he would share, and but especially their diet. Have their parents dial in the diet. So what goes on in the brain? Well, the studies show that brain chemicals called neurotransmitters don't work the same in children and adults with ADHD, and there's differences in the way their nerve pathways work. Certain parts of the brain may be less active or smaller, actually, in children with ADHD than those without the disorder. And the chemical dopamine plays a role. It carries a signal between the nerves and the brain, and it's linked to their movement, sleep, mood, attention, and learning. And we know that that chemical dopamine is playing a role in their development as well. Now, there's good news. Neuroplasticity, we know that the brain can be changed both structurally and chemically by experience. So enriched environments tend to lead to larger neurodevelopment. So the things we're providing at school to help students get that rich environment do help. Recent research has uncovered evidence of neurogenesis, or the production of new brain cells in human brains in some conditions when the environment is enriched and when we teach. So that's the importance of teaching those behavioral skills, is that you may have the ability to actually cause some regeneration or some growth, neurogenesis. The brain is complicated, but we have so much brain research that changes frequently. In fact, this presentation I had just redone 2 years ago, and there was so much new information that within 2 years I needed to update it for you. So this is the short version. The thalamus relays information from the sensory receptors to the brain, and then the hypothalamus kind of controls behavior, but it also regulates hunger, thirst, body temperature, sexual drive, and it is directly involved in emotional behavior. The central core of our brain serves to alert and arouse the higher brain response to incoming information. Sometimes you hear people call this the primitive brain. Scientists call it the central core. The limbic system is rings of structure that's located between our central core and our cerebral hemispheres. So if we want to learn new information, or we are struggling with emotional control, that hippocampus is essential in new memories, and the amygdala, along with the hippocampus, is important for regulating emotions. One of the things they found in many of the people that they've taken a look at who suffer depression, autism, some ADHD, is an actual shrinkage in that amygdala gland. And so we know there's in some cases, a little atrophy, and in others, just a smaller organ to start with. The cerebral cortex contains the occipital lobe and the temporal lobe. And the temporal lobe is responsible for those complex visual tasks, and it receives and processes auditory information. It's also involved in our balance and our emotion and some language. This temporal lobe is highly influenced in our students with autism. One of the things we know is that for some reason that area of the brain in students with autism often thickens. And so you can see why that would cause them some challenges in emotional and behavioral regulation. The cerebral cortex consists of the parietal lobe, which receives our sensory information. This is our spatial abilities. When I took geometry, I'm pretty convinced that I think I really struggled with this. I think I needed new neural development, but the frontal lobe coordinates information from other lobes, and then it controls our voluntary movement, our attention, setting of goals, expression of appropriate emotions. It controls our self-control. That frontal lobe is important, and again, in ADHD and in other students that suffer from mental illness or emotional or social disorders, oftentimes this area is very, very inactive. Then we have hemispheric specialization. So we know that you have the corpus callosum that kind of divides the brain into two hemispheres. Unlike what we've been heard, there really isn't a right brain, left brain super connection to our learning, but we do know that each hemisphere appears to have specialized functions. We have children today who are there to control seizures, which occur when the electrical movement across this corpus callosum fires, or misfires, I guess I should say, kind of storms, causes seizures. I've had students who have had large sections of their brain removed. I've seen where there are children that they have literally removed half of their brain, and they still do this today to stop the seizures that otherwise would certainly kill them, and the other part of the brain has to take over. Our spinal cord, of course, is important in our nervous system, and now they're doing a lot of things with pain therapy in blocking certain parts of the nerves that originate down the spinal cord to control pain. But it is a complex cable of nerves, and it connects our brain to the rest of our body. And it's carrying those motor impulses and the sensory information throughout our body. It controls some of those protective reflexes without any input. So if your students struggle with spinal cord challenges, spinal bifida, they're in a wheelchair, sometimes it's difficult for that sensory information to get to that executive functioning part, and you'll find that they kind of act and then think rather than think and then act on occasion. We have our peripheral nervous system, and our peripheral nervous system is divided into two kind of responses: a somatic response and an autonomic response. We know what that means. The autonomic response is automatic. It's our breathing, it's our heart beating. The sympathetic division is most active, though, when you're angry or you're afraid. It's our fight or flight response. You get the increased heart rate, the breathing. It even stops or slows down your digestion. The autonomic nervous system is responsible for calming the body and reducing our heart rate and restoring digestion. But in kids with trauma, that they continue to often stay in that heightened sense of alert. There are many things that can damage the nervous system: trauma, infections, degeneration, structural defects, tumors, blood flow disruption, autoimmune disorders. There are genetic and metabolic problems from birth, toxic exposure, and the direct effects of drug exposure. There is an extensive list of children's neurological conditions, and I'm not going to read them all to you. You can kind of peruse them at your leisure. More neurological conditions, and more neurological conditions. and more neurological conditions. Oftentimes, our students who have challenges with one disability or one disabling condition get it in multiples. They will struggle in multiple areas. So it's likely that a student with autism may also have a mood disorder or some attention deficit, or a student with attention deficit disorder might struggle with mood disorder. So often they say what they concurrently exist, or they are comorbid. Now, not all maladaptive behavior is just willful. There are billions of biological functions that can conspire, so to speak, to cause our tough kids. And in those cases, the behaviors can be managed, but you're not going to cure them. You won't call them into your office, offer the right punishment and exhortation to change their ways and fix them. You can learn to manage them effectively. And I'm going to tell you, sometimes it's more tiring than others, but absolutely it is rewarding. Autism spectrum and pervasive developmental disorder are often interchangeably used. We're going to just take a look at a working definition of autism spectrum disorders, the most effective behavior strategy, and what every parent and student with autism wishes you knew. Autism is a complex neurobiological disorder, and research tells us that autism tends to run in families. Changes in certain genes increase the risk that a child will develop autism. If a parent carries one or more of these genes, they may get passed to a child, even if the parent does not have autism. Other times, these genetic changes arise spontaneously in the early embryo or sperm or the egg to combine to create the embryo. Again, the majority of these gene changes do not cause autism by themselves. They simply increase the risk disorder. A lot of what we've learned in autism spectrum, we can apply to other developmental disabilities. We are literally pouring millions and millions of dollars into autism research right now because it is a national epidemic. Autism takes on different manifestations person to person, but so do all developmental disorders. In a message from the CDC, they want us to know that there are signs and symptoms of autism, and that there are ways that we can help parents to identify students who might be struggling, who are on the spectrum. This is one of the more challenging things I've noticed is as educators, we're told, well, you can't diagnose, you're not a doctor, but heavens, we should share with parents that the behaviors we see in their child are similar to other students that we have had in the past who have been diagnosed by their physicians with autism spectrum disorder, and that next time they go to their pediatrician, perhaps they could have that discussion. Oftentimes the parents don't thank you for that. But if early intervention is important and critical, the sooner the diagnosis, the better. Many of the students that I had as an elementary teacher and as a middle school teacher were getting their diagnosis for the first time at 10 to 14, 15 years old. And so much of the window for intervention and remediation is beginning to close. So that was tough. There are possible red flags if you have students that are nonverbal. You have students that are struggling with their language skills. If you have students who are not pointing or sharing or trying to draw you into their world and share things that are exciting them. If they show violent or intense temper tantrums, if you see odd movements or repetitious behaviors, if they're overly active, uncooperative, or resistant, that's kind of the definition of our tough kids. They don't necessarily want to play with toys. They don't smile, they have poor eye contact, and poor social skills. The CDC recently changed the diagnostic criteria for autism, and they developed other illness categories in the DSM-5, which is the Diagnostic Manual for Physicians, trying to more clearly define and restrict the disorder. Some of it was in hope that it would stabilize the alarming increase in the percentage of children diagnosed. However, that's not the case. So we have gone just in the last 10 years from children being diagnosed, one in like 150 births, to then it was 2 years ago, 1 in 68. And now, after the change in the diagnosis that was supposed to stabilize, it's now 1 in 59. So it doesn't appear to racially discriminate, although fewer students who are Hispanic or African American will be identified. It's 4 to 5 times more likely to occur in boys, so 1 in 38 boys. So basically, one boy in about every middle school, high school classroom is going to have been diagnosed with autism. And the increase is alarming, but it's also resulted in a lot of money being poured into research, and the things that oftentimes work for tough behaviors in students with autism work for other kiddos as well. So what are the risk factors? Because you can't help but ask yourself, what is going on? Well, if you have twins, if they're identical, they're more likely to both suffer autism if one does, as high as 96%. If you have a parent who has a child with autism, they have a high percentage chance of having a second child who will also have autism. 10% of the people on the spectrum have a genetic, neurological, or metabolic disorder as well. 41% will have a reduced IQ. 40% are nonverbal. They don't talk. They may not be able to develop many words or means to communicate. So we're going to take some of the research from autism and then a lot of what has worked in classes and with students and in research facilities for students that struggle with social, emotional, and behavior disorders, and kind of take a review. So here are some of the behavior challenges that you may see. Temper tantrums, aggression that can result in a threat to the safety of themselves or other, disobedience, general irritability, emotional dysregulation. Sometimes they hurt themselves, sometimes they hurt others. You may see stereotypical behavior or saying things that are inappropriate, lacking a filter. Oftentimes you see screaming, yelling, crying, whining. They may throw things. The first thing that we take a look at is that in tough kids, oftentimes they have some sensory issues, and we've had great results if we take a look at having just getting the input of an occupational therapist. Sometimes when you call the OT, if they haven't had a long relationship with you, their worry is that you're trying to get them another kid. And I'm going to tell you, after about the 3rd grade, it's tough unless they have some significant disabilities for OTs to want to help them with things like handwriting, and rightfully so. But they have a wealth of information on how to meet the sensory issue needs for tough kids. And oftentimes you can do a lot to control behavior by just putting sensory breaks into the student's schedule. So they can be hypersensitive or hyposensitive. So the hypersensitive kids are super sensitive to noises and touch and textures and tastes and smells and any combination of those, or maybe one on their own. How many times do you put your hand on the shoulder of a student and have them go, ouch, because they don't experience sensitivity in the same way? The opposite side of that is the hyposensitive, and they seem to need more of every sensation. I had a little guy who had a traumatic brain injury, and he had hyposensitivity, and he didn't feel pain in a normal way, and he was constantly like flopping out of his chair. The biggest challenge to him mainstreaming was his ability to stay seated, and he would run into things, and it seemed intentional. He literally was the bull in the china closet, and we were able to help him mainstream in elementary school. In junior high, the sensory integration and I'll tell you in a moment what that looked like, the sensory integration helped him to be full-time in the regular classroom. And by high school, he just was a typically developing child who played a lot of sports. But in elementary school, what we would do is we would let him climb on the monkey bars, drop, climb the monkey bars, drop. And we would do this at about 3 intervals during the day. And it stopped him falling out of his chair, running into people, running into things. And it, of course, changed his life. Our most prevalent or chronic and severe behaviors in school will occur with students who have autism or emotional disturbance. And these children also, I just want you to know, frequently have strong advocates. They may have multiple service providers who will come in and be present at a meeting. So you definitely want to make sure that you're meeting the legal letter of the law. They're a protected class of individuals. They're entitled to that free and appropriate public education. And I would just say morally, they're entitled to a caring staff of educational professionals. And the last thing you want to be is less knowledgeable than they are when you're sitting with them at the table. And I've just found that knowing a lot of this information has been super important as I seek to strike a balance between meeting the needs of the students and protecting my staff and other students. So one of the things that we're going to ask ourselves is, does our school or a school district have some specialized classrooms? Are there places that we already have in place where students can receive some of that higher levels of support? These oftentimes have a high staff to pupil ratio. I mean, sometimes as little as 1 to 2 or 1 to 3. They might have specialized curriculum, but that curriculum also involves social and emotional training. It involves behavioral training. It involves empathy training, friendship training, or a combination thereof. They'll have behavioral supports, social skills, role-playing, chances to act that out, adaptive skills, and habilitative services, which we used to call them rehabilitative. Now habilitative means that you're learning new skills. And they have specially designed academic instruction. The federal government has literally put millions of dollars into Medicaid so that district can provide some of these expensive services. School districts take more or less advantage of this because the billing's tricky. Some districts have abandoned it because they can't quite figure it out or figure out a way to do it all the time without making any errors. But absolutely, you want to know what's available for these kids outside of your school, because the teacher's exhausted, you're exhausted. It takes a village, and you want to make sure you know who's in the village. Most of the students with tough behaviors spend their school day mainstreamed in the general education classroom. They're going to attend their neighborhood public school. That's your school. They're going to need varying levels of accommodations and support. They will graduate from high school. They will need strong relationships with their teachers and administrators to be successful, and they will have friends and family and people who care about them. Parents of tough kids say they want the principals to know that if you've met one child with a behavior disorder, you've met one child, because really they're no two are alike. I would tell you, you can still implement needed supports, and some things that work for other students with that behavior will work for this one. That all staff members need to be trained with multi-systems so that they can provide those multiple tiered supports. And the National Research Council says that teachers really receive relatively little, if any, formal instruction. And I would just ask you, how much of your professional development given by the schools have been to deal with these tough kids? Probably very little. And I hope as an administrator, you'll change that, because it's one of the main reasons teachers leave the profession, tough kids. Implement an abilities awareness program, because you want the other kids to be able to understand students with disabilities. and to be able to be friends and to create a caring community and supportive community. And be careful not to blame the parents. Parents say, we don't know how our children came to be challenging or how to treat them. And even the experts are still trying to figure that out. And that's true. And while we say the apple doesn't fall far from the tree, the parents didn't ask to have the biological problems either. So you kind of get a spiraling effect where you have parents who had challenges having children who have more challenges. And we have to work as a partnership rather than a, they did it too, their own. Never underestimate what the children can do. They might need safety enhancements. They might need an IEP, but we still need to do everything we can for them. Parents want you to know that the children need to be prepared for changes in their routine, changes in their staffing. Consistency is their friend. If you use a child's strengths, it will help you to be able to build on those strengths and remediate their areas of weakness. Involve everyone. I can't say this enough. The more people you have wrap around the struggling student, the less they will struggle. Involve everyone. Don't assume that parents aren't working with you. If the parents aren't working with you, sometimes they're depressed. They feel powerless. Sometimes they've had to fight and fight and fight and be an advocate for their children, and they forget how to be a partner to you. But that's an area that I think was a strength of mine as administrator, was being able to partner with parents and bring them on board to work together to help their child be successful, because ultimately that's what we both wanted. Use data to your advantage. Share with the parents what you've learned. I cannot tell you how many times parents gave me ideas that worked and I gave them ideas that worked, and that partnership together made those students far more successful. Now, what can you do in the classroom? Well, one of the most research-based strategies is social stories. Students with tough behaviors have difficulty understanding social expectations, especially how the nuances change situation to situation. So social stories are stories that explain expectations for school occurrences at home and at school. Your SLPs, your speech language pathologists, are typically replete with these skills. They can create these social stories for you. They can help teachers work to give these kids a script in their head that they can run when they're dealing with transitions and times that it's challenging, so that they know what they're supposed to be doing. And involving your SLP in helping you is important. But again, their first thought is that you're going to them trying to identify a kid and increase their caseload. So it takes a little bit of prep to help them realize that you're seeking their professional opinion, their professional knowledge, and that they're going to be an integral part of helping this child be successful. They don't necessarily have to be on their caseload. There are tools and techniques that work with all children. Visual schedules. Visual schedules are critical to stemming, especially episodes that occur later in the day. Students don't know what their schedule is and what's coming next. It's challenging. Some people use pictures only, some people use pictures and words. Once you get up into middle school and high school, words will suffice, but really the student needs to have a schedule of what's coming, what the expectations are, and that really helps. I just literally had a meeting last week with a young guy in our school who he starts about 1 o'clock and he's tantruming, and he's telling you what he wants. I want to go home. I hate school. I don't want to be here. And so we put a visual schedule in place, wrapped some supports around him so he could see where there were breaks or things to look forward to. We added one piece every hour, and then in the day with having a teacher pick him up, do some sensory movement in the hallway, work on some numbers mathematics that he was struggling with, but in a fun way. And then we had a peer buddy that would meet him and walk him out to the bus, and behavior stopped. Positive behavior supports are essential. It has to be a key ingredient of any intervention plan. They're intended to allow children to focus on their instruction and be successful, because either we're supporting by training them in what they need, but we're rewarding them and catching them being good rather than waiting for them to misbehave. And then we're teaching the appropriate behaviors and reward the student when they do them. This always reminds me of, I took golfing lessons, and I had a golfing instructor who he showed us the stance. So our first lesson was he showed us how to hit the ball, and we were on a driving range and just how to hit the ball with the driver, and that's what we were going to work on for the next several lessons. So he showed us. Well, then his strategy is to say, if you weren't doing it, no, assume the posture. Well, guess what? I didn't seem to be able to recreate that posture, and watching him do it did not mean I could do it. And after 8 weeks of being told every time I did something incorrectly, but never being shown or taught how to do it correctly, I gave up. I live on the golf course. I don't golf to this day. And that's what happens to our students. If we're only telling them what they did wrong, how will they ever learn how to behave appropriately? And then if all the attention they get is when they misbehave, will they want to do anything else? Another area that's huge is if you have behavior that's a student trying to get out of a task, to escape or avoid some aspect of the task, you have to modify that task initially. And that's tough, because when you get into high school, you're going to have the high school teacher who's going to tell you every student needs to have the same expectation. And I'm going to tell you that if you have a behaviorally challenged student, you have to, if you're getting 0 work out of them now, and they're getting an F in the class, getting some work out of them, and them getting a D in the course has to be an improvement. That's my opinion. So in task modification, you're going to change the aspect of the task so that the work is less aversive. One of the things you can do is if there are multiple steps, let them do the easier demands first. A big component of reducing avoidance behavior is to reduce the workload. If you have a student that's producing no work, oftentimes just folding the paper in half and having them decide whether they want to complete the top half or the bottom half, you'll start getting compliance. Another strategy is that they circle a problem, they do that problem. When they finish it, they can cross out the next problem. Sometimes we often start with a choose 5, so do 5 problems. And again, if you've been getting no work out of the student, the fact that you get some work and you are able to build on that is important. This is also done well when you collaborate with your resource teacher. Sometimes you can use your titles teacher, your reading specialist. You can oftentimes incorporate your dean of students, or if you have a discipline area the students can go to, so they can manage this if it's challenging to get your teacher to buy in. You build on the successes, and again, you're rewarding the behaviors they are performing. You want to intersperse maintenance tasks with acquisition tasks. So if the student has the ability to practice something they already know, they're less likely to want to avoid it. New tasks or acquiring new skills are hard. And again, what did we learn about students that have behavioral challenges is most of them struggle with academics. Very few of them have the academic skills. Even if they have the intellectual skills, they may not have the academic skills to perform at the same rate as their peers. You want to try to mix up what you're doing so that the students have opportunity to try it in multiple locations. Maybe you let them stand. They have a standing desk. They're sitting on a bouncing ball. They're sitting on the floor. I had students that I just wouldn't give them a chair because if they sat in it was just not going to go well. So if they stood, we could get the work done, and we just raised their desk, and that was effective for many of my students with ADHD. You can enrich the environment, so you may offer the ability to let them play music in their headphones while they're working, or they finish their task, they can do art, or you put the task within a game. This page deals with multiple intervention and supportive services that are kind of unique to the child, but I'll have this uploaded, and each of these have links that you can go to that talk about these specific supports that help behavior and communication approaches, picture exchange systems for our students who are more nonverbal, applied behavior analysis, which is critical for our Tier 3 students, discrete trials, again critical for our high-popping Tier 2 and our Tier 3 kiddos, skill fluency, sensory integration, floor time, medication, and again, that's finding out what you have available to you. Working in the Boise School District, we could refer a student to the behavioral health team, where a whole team would meet and discuss. Now I'm in rural Washington, and we barely have the special services to meet our needs, let alone a doctor that I can consult. Diets and vitamin, always talk to parents about diets and vitamins and what's going on, and see if they can help support you that way if they're not willing to take the child to their pediatrician. And again, you have to be careful, because if you say to the parent, you need to take your child to the doctor, the schools are financially responsible to pay for that. If instead the conversation is encouraging the parents, hey, you know, I'm seeing this in your child. Next time you visit your pediatrician, might you be willing to ask and give them some questions that they can ask? And oftentimes that will help the pediatrician to realize that other things are going on. There are complementary approaches, facilitated communication, helping families cope, and if you have title dollars, you can take a look at your family engagement activities, might be parent training. Advisory Board on Autism has a myriad of ideas for you. Wraparound services, oftentimes that will involve students that are part of health and welfare behavioral health program. This site, Autism and Mainstream Public Education, help you with lots of little strategies and things you can do to help students with autism. And then in high school, take a look at Autism in Adulthood. It'll help you. If you are a high school principal, I would suspect you know, but many of you will have special education programs that serve students all the way to age 21. And those students still will struggle often with behavior. So you're still managing their behaviors past those typical high school years. This is the non-negotiables to managing behaviors. You have to identify the function of behavior, and next week we'll begin learning how to do that. You have to come up with a plan to provide an extinction for unsafe behaviors. You have to have the ability to train a replacement behavior. You have to be able to initially remind the student to use the replacement behavior. You have to use lots and lots of reinforcement up front. I tell you, I should own stock in the gummy bears I buy from Costco. Costco sells gummy bears that don't have don't have food dye, and they're made of fruit juice. And I buy them by the bagfuls. That you gradually fade out contrived reinforcement, so eventually the gummy bears are supplanted by, hey, great job, high five, fist bump. But it's critical that you train all staff, and that you're supervising the implementation of that process. Otherwise, you'd be managing that student in your office a lot. Now, behavior management in our nation begins with a freedom of choices. So you have this whole spectrum of freedoms. When an individual struggles with their choices that infringe on the safety of others, the circle tightens. So here you may have a student that begins their interaction with juvenile justice. They may have a parole officer. They may be put in a self-contained classroom. They may be given additional aids or assistance. Then when those tier 2, tier 3 things don't happen, it gets kind of punitive, because here is more increased supervision. So you might have to have a visit to the state mental hospital. Many of my students spent a 6-month or more period of time at Blackfoot or Orfino. Many of the students spent weeks at St. Alphonsus Behavioral Health. And so this, again, you get more supervision, less freedom, the circle tightens. And if that doesn't work, then you get jails and institutions and locked cells. And then ultimately our society says, if that doesn't work and you still are such a threat to yourself and others, that we have electroshock treatments, hospitals for the mentally insane, and the death penalty. So I guess what I want to say with that is that it's important that when an individual struggles, that we begin providing the supports so that their freedom doesn't infringe on the safety of others. And we can take away a lot from how we are working at a national level to just say that each step the child becomes more challenging. We want to put more supports in place. We want freedoms to be removed. We want to increase their level of supervision. Suspending them out into the community is not that. What we want to do is control those behaviors. And the key to do that is the number of eyes on the individual, and to reduce, remove, or secure their freedoms so that we know where they are at all times and that we have a plan in place. So you say that and you go, my gosh, why are they in the schools? Well, legislation. A lot of it has to do with court decisions, and you know this from your other graduate and postgraduate courses. But it's also the right thing to do. They're children. The school is a foundation. It's critical for them to succeed. This school is the biggest net that'll help them to be successful in life. Mainstream students that are in the classroom with the students who are properly treated and supervised, they'll learn compassion and they'll accept diversity. If you're not wrapping around the students, sometimes that's not the lesson they take away. Special education classrooms help students develop across many domains. Let me delete that word, I just noticed. The old method was to ship them off to day treatment or state hospitals. And it's not that that doesn't happen, but it happens less frequently. And I'm going to tell you something. One of the challenges that we now see is a result of something we don't talk about. As a nation, we practiced eugenics into the 70s. My adoptive mother owned a shelter home in Hayden Lake, Idaho, called Harmony Heights. And it was a 126-bed facility for people who came out of Orfino and Blackfoot, but could not live in society, but were more independent than the state hospital. And the first thing that an inmate at Orfino or Blackfoot received was sterilization. The second thing was all their teeth pulled. And I don't know what the deal was with the teeth pulling, but they were given dentures. And we practiced eugenics into the 70s, where people in mental hospitals were routinely sterilized. And what we see now is we have third generation children who had parents who were disabled, who had grandparents who were disabled, and some now have great grandparents who were disabled. And so the conditions, of course, sometimes are becoming more severe, but we also didn't have the children and the adults in the mainstream setting, but the courts say no more. So that's not something we're going to be practicing. Instead, we're going to need to embrace the diversity of life in our schools and help those students be successful. We need to provide skills for these students to become independent. Research-based education that targets developing those social skills and closing the learning gaps simultaneously. We have to have a structure in place for our students to develop all those developmental skills they need in social interactions, in academic behaviors that help them to be successful. And we need small group instruction to protect the safety of our students, families, and staff. We don't want the story of our other students to be one of trauma. So what does their future hold, these challenging kids? They want to learn, they want to grow, they want to reach their dreams. Ask them, they have dreams. They say we want to be the best that we can be. We want to increase their social competence, which means friends, relationships. They will love and be loved. One of my most satisfying times was when students who are in my social emotional behavior room got their first best friend, when they were invited to a birthday party, when they were able to join their class on a field trip. It was priceless. They want the same things every child wants. With your help, they will acquire coping strategies to deal with the lifelong symptoms of mental illness and biological impairments. They will have jobs and families, and they're going to have life struggles. But we need to give them the skills to be independent and to think morally. So many of you in your responses talked about your families teaching you that moral thought. Our students need to be taught that they don't always, we can't assume they have it. I want to share with you the next slides I have. These are written by a student I had who had autism. She wasn't diagnosed until the 5th grade. Previously, she was diagnosed with anxiety, and life was tough for her. She didn't have friends at school. She was constantly in the principal's office, and life for her has radically changed. She's now grown. She's graduated high school. She has a job. She has a boyfriend. But I want to share with you her kind of coming to grips with this. So she wrote a book, Different is Good. And first she says she was born with Asperger's syndrome. And of course, as a 5th grader, she didn't spell it correctly. But she says her mom said her head was bigger than most babies. And she draws a picture of her as the baby. And she always saw herself as a dragon. Just you'll see as she relates her story that she depicts herself as a baby dragon here. So Asperger's syndrome means that my brain works differently. My neurons work other ways. Some things about that are good. I'm a really good artist. I can see pictures in my head. Part of Asperger's syndrome is being a little clumsy. My hips feel stiff and I can't run right. That's okay. I don't really like to. At school, I noticed people were treating me differently. They made fun of the way I run. They teased me about the way I bite my thumb and shake when I get excited. I tried to catch the kids who teased me, but I couldn't catch up. I tried roller skating, but I fell on my butt and it hurt. I don't rollerblade anymore. I still remember exactly how it felt. I hear that most people's memories fade. Not mine. I can remember like it just happened. I quit riding a bike in 4th grade because it was hard. I didn't have the balance to ride without the training wheels, and the kids teased me. She has since learned to ride a bike. I get frustrated sometimes, like when people say things to me or someone wants me to do something that seems impossible. It feels like I've been punched in my stomach, and my anger starts to rise up in my throat, and if it comes out of my mouth, it's too late. My doctor calls it anger management problems. I take medication to help me keep my temper under control. There's her as a dragon roaring. My mom helps me with my hair, my clothes, and my dental hygiene. I don't really care about these things. It's too much trouble. And I'd rather watch TV or something fun. That's the story of many of our kids with challenges. They'd really rather just stay in the things that are easy. Learning to read was easy. Letters and words came very easy to me. I remember facts really well too. I hear about animals or see a video or read things about science, and I don't forget it. I still know it 4 or 5 years later. I think I might know it forever. I like my life. I have many things that I can do really well. There are some things I have given up, but I don't miss them. I have friends, and I'm learning lots of things. Someday, I think I'll be a famous artist. Lots of famous artists were different. I feel good to be different. And then she created a drawing for me when she was a senior in high school, and she shared it with me. And she said, this is how I'd like to end my story. She's no longer the dragon. Do you see where she's riding the dragon? I loved that. She says, I've learned to tame the dragon. But that's because teachers and administrators like you wrapped support around her and helped her to develop to her potential so that she could have an amazing life. So this is your assignment. This is what we call the midterm test. Please don't be stressed. You know, that word exam often strikes fear in our hearts. This is a very low pressure exam because you're going to create it. Now that you've viewed this PowerPoint, write 18 multiple choice questions with 2 or more plausible distractors. Write 5 true or false questions and 2 short answer or fill in the blank or even essay questions. And then you can create that test in one of 3 formats: on Canvas, on a Nearpod document, or Quizlet. The only thing I ask is you send me an answer key because I want to make sure that you also know the answer to these questions. And it's a way for you to interact with the information and to just commit it to memory, because as an administrator, this will help you to stay objective and to remember that when nature and nurture collide, it creates some tough kids. But you have the skills to help these students be all they can be in life. And we're counting on you.